So we are coming to our next presenter, Dr. Reena Bhargava. She's a co-founder and CEO of BioTrax.
Thanks so much, Julie, and thanks for hosting. And I'm wearing a beautiful bracelet here that Siri made. So the moment somebody mentions Siri made this, I'm like, there's no way. Even if the color doesn't match, I gotta wear it. Thank you, Siri. You're an inspiration, and all the stuff you're doing, getting to college and so forth, is beyond inspiring. So go at it. We learn so much from you. I'm a physician. We're building BioTrax AI. This is an AI-powered, physician-guided longevity medicine platform. And the problem is not unknown to people. We got 100+ billion precision health market. The numbers are crazy, but significant disarray there. There's consumer confusion. Millions being spent, and you've heard crazy stories. People spend, $1 million plus for themselves, or 20,000 a year, or 10,000 a year. So this is out-of-pocket expense for longevity testing. They get their results, and now that's not an uncommon comment. You can read on Reddit or whatever. And then there's clinician frustration and a missed opportunity. There's this exploding consumer demand, but the tools to participate in this care are missing. So our solution, AI, yes, let's leverage that, let's power through that, because that's an amazing, amazing mechanism with the doctor. So we're integrating AI with ongoing care, and the consumer or the patient and the physician work together to see what we need. Agentic AI tools that analyze and personalize the results. So it really empowers the physician who can validate and then enhance the care. With personalized therapeutics, these are prescriptions we may need. We'd say, hey, here's an opportunity to get this patient started on metformin, which we might miss in the crowd of things, health coaching and ongoing monitoring. And so the BioTrax AI product would be an integrated, dual-sided platform. Physicians who have access to full EMR, an AI engine that really helps them with their administrative work, with many, many other things, review systems, prep before you go in to see the patient, HIPAA compliance, secure lab ordering. And then for the patients and members, you've got the AI coach, you've got your doctor. So it's not a one-size-fits-all that you go to these other platforms. You've got your biomarker testing, scanning, a digital twin, built with physician input, knowing what we need, what we hone in on, with wearables integration, a community, and a marketplace. What's the value proposition for our physicians? Expanded scope of practice for preventive longevity medicine. And let's face it, that is not going on in clinics right now. Whether you're at Sutter or you're at Palo Alto Medical or you're Kaiser or Blue Shield or what have you, we're not doing that because that's not covered. And yet it is available. And so what we can use, efficient AI-enabled clinical tools to make our physicians efficient and really make them feel good about what they're doing. Personalize it because I know my patient and I know their family history, etc. And then on the consumer side of things, personalized physician-guided insights. You really, when you're not feeling well, no AI bot's gonna answer our care, and let the physician be aware of our risks and whatever, genotyping, what have you, we might get in the scheme of things. So, market opportunity, those numbers are huge, more than $1 trillion market, and then precision medicine itself being what it is. We have about 500,000 primary care physicians, and a significant percentage, 40% or so, in private practice. Let's do the math, being amazingly conservative. conservative, and we're talking about an ARR potential for 500 million. The business model, dual-sided platform revenue, physicians, platform subscriptions, AI-enhanced test reporting, consults that get added on, and for the patients and members, depending on what they need, what their pocket can afford, and what their curiosity and knowledge would be. Biomarker testing, tracking. More for the business model, there's biomarkers, there's insights, there's target delivery, target discovery, clinical validation, translational value, research processes, pharmacy opportunities. The team, we call ourselves the insiders. I'm Reena Bhargava. I was at Kaiser, like Uri, medical director for more than 20 years in telemedicine and digital medicine. I built electronic visits. I was a lead clinical physician for electronic visits in Northern California for 4.5 million patients. We launched it in 2018. It's still going strong and has not needed to be touched, just added on. Triple board certified. And then Bhargava, he has more than 14 patents to his name. He has done AI stuff before AI was coined, so to speak. Speech technology, which he sold to Cisco, successful exit. Search, sold to Amazon. He ran all of Amazon's visual search and augmented reality for 12 years. And recently did a very large LLM development deployment in India with a billionaire there. Andrea comes with as head of product, knows this product really well. She was at Function Health earlier and has been in this space. Dr. Eric, head of protocols. These are our financial projections. You saw how we calculated that in an amazingly conservative fashion. And so third year in, we think this would be the ARR. Our core IP advantage, again, no Dr. ChatGPT, and now not ChatGPT Health or Claude Health. This is really precision longevity medicine, where you need the experts in the room, at the table, subject matter experts who really know what needs to be done. We've done population health projects for years, and now what we have is the power of AI. We can really dive deep in to know who this patient is, model that, and take it to a whole different level. Personalized medicine, precision medicine there, with a continuous feedback loop. A competitive advantage, if you look at that, Function Health just raised $315 million and is now valued close to $2 billion. What does the core offering there is functional medicine. Functional medicine is, root concepts, but it's not the kind of medicine Uri or any of the physicians in this room have been practicing or do you go to when you're not feeling well or even in regular care. So there's that difference. These are physician curated, personalized biomarkers. Lots of people believe in functional medicine, that's great. But again, that doesn't happen when we go in for surgery or are for not feeling well, etc., etc. The results of a significant difference in where we are with the digital twin and so forth, action plans, evidence-based prescription, therapeutic protocols. So if I see an opportunity for a GLP-1 that does get prescribed, I see an opportunity for statins, those do get done. Continuous clinical monitoring, no fragmented care there, physician practice tools, funding as $6 million. We do have SAFE for $1 million, and the whole idea again is this space is huge. And what we want to bring are the best folks who can help build this platform. Customer acquisition, physician education, CMEs that I'm already building, and we will present in just a month or so, AI to scale and democratize. We've got a world-class advisory board, Stanford professors in preventive cardiology, in exercise and sports medicine. Paula was here. She is an advisor, and Paula is, she's going to talk tomorrow, I believe. We went out with a successful exit. So a couple of physician CEOs who are in telemedicine field, Dr. ER physicians, so a really world-class advisory board. Uli, I'm going to lean on over and over. I've joined Uli's team as well for startup help.
Thank you, Rita. Okay, we can start here.
I'll try to keep, I got several questions, I'll keep it in
No, one.
Alap Shah, solopreneur, ECSMD. So, as we know, wearable devices have just recently, 4 days ago, become deregulated, which is great news for WHOOP and other companies. Have you thought about incorporating wearable device data into this now that there is?
It's very much there. It was on the slide as well. Wearables integration will be there. And as far as the digital twin goes, if you think about wearables, the time frame for that data is very different from the others. So we would drop it once a day. And yes, absolutely. That's what is new and exciting. Well, we have huge insights about what's going on, and probably my heart rate is really high. I get that stress period just around this time, but that's something that we were clueless about. So I really do think that we can help our patients, help the consumers get those additional insights that we never had previously.
Great. Let's see. Second question here and third.
Just playing devil's advocate, I am an MD, retired, but whatever. For non-pharmaceutical and non-surgical interventions, why do I need MDs on board?
So, would you not agree, especially if you're a physician, that there's so much a physician adds as far as evaluating, somebody's health, even if they do not prescribe a prescription, prescribe a medication. And I'll tell you this, I did an NIH fellowship at Stanford 20 plus years back. In this very realm of insulin resistance, we did insulin clamp studies from 6 in the morning. No medications when we did, except when we studied some medicine from pharma, doxycycline, etc. But there was so much insight when we looked at 3 weeks of being on a high fiber diet, where the VLDL cholesterol goes up, the triglyceride, and so forth. So there's so much we add. And one of the most important things, trust. The amount of trust we have in a physician who has kind of devoted so many years to building up experience and expertise, we cannot devalue that. And different strokes for different folks. We're not talking about 100% of the patients, 100% of the consumers. There are some who will, and money, what it costs is really relevant. So I'm going to dig into my pocket. And so there will be some folks who say, this is available for $199, I'm just going to go for that, or I'm not going to spare $199, or who cares? I am paying $1 million a year. There are people like that who do that, and or $20,000 a year, 10 times. The idea is to democratize this, scale this, because I feel like we owe this. This should not stay in concierge medicine. This really should be available for all our physicians to offer as needed, when needed, if the
Good answer. All right, last
I'm
question.
passionate about it, maybe.
We can tell.
Thank you, Dick.
So you mentioned there were multiple tiers for the patients for engaging with your clinic. One was like, I think the maximum tier was like less than $500. How do you justify your time commitment at $400 or $500 per month?
My time for
The
the
patient.
package. So a lot of it will be here's the deal. That we are going to empower the physician with actionable insights, with processing the results, and make that way efficient. I'll just give you an example. Electronic visits that we developed, and I was the lead physician developing the physician interface and the patient interface 2018. I've published about it in JAMA as well. The physician time is 3 to 4 minutes in that. So compare that to 20 minutes for a regular visit, maybe 15 minutes. 3 to 4 minutes. If we do it right, and that was before AI, and we do it right, and we can reduce the administrative burden, the cognitive burden, things like that, we could do it smartly. I've got a great team of Kaiser and Stanford physicians. We're building towards that, and hopefully, and it will be an iterative process, it always is. But thankfully, if you do it right and think it through well, you may not even need to go back to touch the original line.
Great, thank you very much. It's amazing.